welcome back. You're watching Mirror Metro with me, Griha. Now, the Karnataka Health Department has launched a Sero survey among unvaccinated children between the age group of 6 and 14. The survey is aimed at checking the prevalence of COVID-19 antibodies in the kids and whether they have the natural immunity to fit and fight it. The survey that will collect samples from about 5,000 children in the state will be completed in 2 weeks. In fact, nasal swabs, oral swabs and also blood tests will be done on the children under the supervision of pediatricians. Now, joining me on the broadcast is Mr. Randeep, who is the Karnataka Commissioner for Health and Family Welfare. Mr. Randeep, thank you so much for joining me on the broadcast. An important thing that is happening in the state of Karnataka, never before done on children, a Sero survey. Just take us through what exactly is going to take place in these 2 weeks.
Yes, so Karnataka has already had 2 rounds of Sero survey, and the third Sero survey, the Technical Advisory Committee of Karnataka constituted for COVID had advised us that this time around we could go around and have a Sero survey specifically targeted at children, simply because they are the group that has largely been unvaccinated, and also which will kind of give us an idea of the disease burden, and in case they've been infected, what is the level of antibody protection that they have. So that is why the decision was taken that we need to take a sample of about 5,000 children across the state and go ahead with this Sero survey.
Right. But Mr. Randeep, is the timing, important to note over here? Are we seeing cases in children between the age of 16 to 14, or this is something that is advised so that we have like a data in place?
Yeah, so we had planned probably to take this up sometime in the month of April, May. The timing is also rather appropriate because we're seeing a slight rise in the cases in the state of Karnataka. As you're aware, Omicron, there have been widespread infection across categories. While we are still at probably the 4th wave has not hit us. But this would be an appropriate time for us to actually find out the unvaccinated category, which is largely the children. And even amongst the children, if one is vaccinated, we would like to exclude them from this survey and just focus on the unvaccinated, purely to know the antibody level, the waning of the antibodies, and in case they have been protected through natural immunity by virtue of a previous infection. Now, all these interesting facts would come to light once we complete this survey.
Also, Mr. Randeep, before I let you go, considering the children of this particular age group that we are talking about are also on their summer vacation, so that makes it easier? Or do you think when they were at school, since more and more schools have opened up, it was easier to actually go ahead with this Sero survey?
No, the sample size is not that much. I mean, across 31 districts of Karnataka, it's about 5,000, well spread out. And of course, the children's parents' consent has been taken, saying that they would be participating in this survey. It's largely nasopharyngeal and oropharyngeal swabs with about 2 ml of blood that we take. So the parents are counseled, and the children are told that this is more for the study perspective. And largely we have had cooperation. We have in fact completed about 834 samples, which is about 16% of our target. As you rightly said, over the next 2 weeks, we should be able to complete this survey and then have it studied by the experts.
Right. Thank you so much, Mr. Randeep, for joining us on that important piece of information, something that impacts our children directly. And this is an initiative that's been taken by the Karnataka Health Ministry there in the state, and also the fact that these samples will eventually help the children and also get the state government that required data on the immunity levels in children when it comes to fighting the COVID-19 virus.